Arthritis Ireland is the national patient support organisation. We fund research as well, but I think it's interesting that it's driven through Arthritis Ireland, which ensures that it's patient centred, and we fundamentally believe that work is good for your health. I think there's some data backing that up as well, and coming from the Royal College of Physicians as well. That meeting on Monday, there was some strong data backing up that, and ultimately people need to work, and certainly at the moment Ireland needs people to work. Why we're doing it speaks for itself. I think we've seen some very strong figures over the last few hours and today. But according to our own Fit for Work report, up to 11% of the working population in Ireland have some sort of illness. And in terms of MSDs, they account for 750 million lost income to the economy a year, which is about 7 million lost working days per annum. So the numbers are significant. They actually account for twice the number of days lost through stress, and 25% of the people with RA, rheumatoid arthritis, have to stop work within 5 years. This figure is quite alarming as well, and is worth reflecting on. The full-time employment amongst people with RA is very, very low at 22%. So if we've never had a reason to do this, now we have one. I think it's very important also in the context of what we're trying to do in Ireland. Obviously, there's a clinical health arm to Fit for Work. It's worth pointing out that we do not have a developed rheumatology service at all in Ireland. We have the lowest number of rheumatologists per head of population in all of Europe. Ireland is in a good position now to do something about this. Just to take you back to 2005, 2006, Arthritis Ireland recognised that working was important for people with arthritis. Our members, the population, the arthritis population, told us, and we did some research as well. And our solution at the time was a product or a program called Working with Arthritis. Now, Working with Arthritis, the roots of which is good self-management. We run the Kate Lorig Stanford University self-management program very successfully in Ireland. So Working with Arthritis was a subset of that. It's a 4-week program, and we entered into a very good collaboration, which is still going, with Abbott Laboratories and FAS. The FAS in red letters there is our national training agency, who are responsible for training individuals to keep them in work and to get them back to work. So it was a good tripartite approach to addressing some of the issues encountered by people with arthritis. The program, as you can see from the picture there, was a workshop-based program. It was a classroom-type setup between 18 and 20 people. So whilst it was a very high-quality, good interactive program, there were some gaps identified. And obviously, one of the gaps was we just weren't reaching enough people. If you have 20 people going through a workshop, it'll probably take about 50 or 60 years to cover the entire population that need a program like this. The other gap, there was no follow-up with the employer. So we were imparting skills and helping people to self-manage within the workplace, but there was nothing done on the employer front. So this is an evolutionary process really within Ireland. We still have this program. It's still very relevant, but certainly the whole Fit for Work agenda slotted in beautifully in terms of evolution for Ireland. Like most things, we felt we needed to set some goals, and the old phrase, how do you eat an elephant, comes to mind, and everybody knows it's one bite at a time. So we've actually set some goals. One, it's very, very important that we have cross-government collaboration to support the labour market participation, but we also need to develop a national plan for musculoskeletal diseases with clear care pathways. Remember the statistic of the lowest number of rheumatologists in Europe. We clearly have to have a plan and an infrastructure in place to be able to address what we want to implement. We really do feel we need to appoint a national clinical director, and we don't want to reinvent the wheel here. Our benchmark, our nearest neighbour, the UK, have done this very successfully. I'd say we're probably 3 to 4 years behind the UK, but we're watching what they've done, and we want what we're calling our MSDs and obviously prioritise early diagnosis and appropriate intervention, and a lot of people have spoken a lot about that today. So in terms of what we've done and making Ireland fit for work under the cross-governmental collaboration route, this really is a long journey. This is where the shoe leather gets worn down and you're shaking a lot of hands and you're doing a lot of presentations. And we have started that process. So we have pretty much covered some of the key ministers in terms of the Minister for Health and her advisors. The clinical director of our Health Service Executive is on board. The Minister for Social Protection we met. The difficulty in Ireland, though, is that we're probably facing, or will be facing, a new government 6 to 12 months' time. Nobody really knows. So this is a very difficult, if not an impossible time to try and continue that journey. We will be continuing to do that, but as you'll see later on when I go into my 2011 goals, the policy bit has to sit beside the implementation bit, and we can't wait for this to happen. We have to implement what we know is best. We've been talking to the opposition party because they'll be in government fairly soon, or some of them in whatever format, we don't know. Moving on to number 2 there, the National Plan for MSDs. We've actually made some good inroads on this. There's a new chief executive being appointed to the Health Service Executive in Ireland, and they've put together clinical programs. There's 19 or 20 clinical programs, everything from dermatology, orthopedics, rheumatology. For the very first time, certainly in my lifetime, is now a key focus clinical program. So we have managed to persuade them to come up with a rheumatology strategy. Point number 2 there, Professor Oliver Fitzgerald. All the medics in the audience will know he's a well-known rheumatologist in Dublin. He's also chairman of Arthritis Ireland. And he has been appointed a national clinical director for rheumatology. Not quite our czar, because he's half-time, but we would hope in 2011 that they make a full-time appointment in a clinical setting, and that would be a significant win for us. They've also agreed to produce a national standard referral process for general practitioners, which is very, very important. Your first line of appointment is your GP. There's about 1,100 clinics, about 2,500 GPs in Ireland, and they all have their own referral system. So a clinician, a consultant, cannot decipher, is this an OA patient, is it an RA patient, is it an urgent patient? So they have agreed to set up a national standard process for referring patients in, which is very, very important. And the final point there really hits on the early intervention bit and the preparation for early intervention in the workforce as well as the general public. And that is the agreement they have accepted, the HSE have accepted to roll out a physio-led MSD clinic, which will result in the appointment of approximately 20 physiotherapists. So it's a population of 4.2 million. 20 is more than adequate to get going on that. And just very, very quickly on a physio-led MSD clinic, the GP refers the patient with an MSD to the clinic. The physios will be specifically trained. Now, this is going to take some time to train 20 physios. Well, first of all, to hire them and then to train them. But the will is there, the money is there, and they have agreed to set it up. The challenge here ultimately will be linking in with the employer. So we've got 1 or 2 interesting things and very important things going on in the clinical setting. We haven't quite got to the employer yet. And on the government cross-collaboration thing, we're chipping away on that. And really, if we can find a champion in the next short time, I think that'll make significant inroads. The work as a clinical outcome goal, last week we had a very successful slot on the agenda for the Irish Society for Rheumatology last week, and I think we made some significant inroads simply because we had Dame Black on the keynote speaker on that Friday morning, and it was a very successful presentation. And the few rheumatologists that are in Ireland were all there and really, really got the idea and are starting to talk about fit for work, starting to talk about work as a clinical outcome. Like the coalition on a European basis, we certainly need to set up our own fit for work coalition. This will bring in high-level advisory groups, it'll bring in employers, the medical world, key government department representations, and we're talking about developing our own work charter, and there's some good examples around there. I mean, ULAR have developed their own work charter. I see Arma in the UK, which I saw last Monday, has a work charter, and it's something I think that we would like to do. Continuing our opposition party briefings. This is something which we would really need to keep chipping away on. So, just to finish up, what I want to present is what we're trying to do from now into 2011, and really in terms of priorities and focus, there are two areas. One is the policy side, which we need to crack, and number one is establishing the coalition to extend the reach into the multi-stakeholder group, because this exercise, this programme, this goal is far bigger than within the four walls of Arthritis Ireland and the partners we have at the moment. This really needs to get onto key people's agenda. We need to develop our champion, probably from that coalition or wherever we can find them. A Herzog, really. We need a Herzog, or we need a Dame Carol Black. So we'll be on it. We'll be on the lookout. We're looking at continuing a series of briefing seminars, perhaps splitting them into policymakers, employers, medical groups. And this is really just part of our selling process. It's part of our influencing process, briefing, which will work alongside our Fit for Work service. So there are things that I, as Chief Executive, have to do. I can't get down into the dirty detail just yet. I have to continue on the policy side. But on the Fit for Work service side, we have actually appointed a work ambassador within Arthritis Ireland. Thankfully, we have funding from both Abbott and FÁS on this, and that'll continue into 2011. So what I'm doing on the policy side, my work ambassador will be implementing the programs, implementing employer programs that are independent of the issues that we face on a policy level, and will not be held up with all the work that I have to do at a policy level. I mentioned there's no point in reinventing the wheel, and that's absolutely true. We will be seeking out all the best practices possible. There are many, many best practices out there. My favourite one is the Royal Mail in the UK. We have the equivalent. Also, there are many, many national health trusts that have implemented Fit for Work policies in the UK, and we have that equivalent here as well. But we'll go beyond that. Ireland is full of multinationals. It's full of multinational companies, from Intel to Tesco. Have these implemented Fit for Work, or successful Fit for Work policies? I certainly hope they have, because it would make my job a lot easier to walk into Intel, to walk into Tesco in the morning and say, well, if they've done it in Europe, you have to do it here, and this is the potential saving. So that, I think, could present some good opportunities for us. We're also going to start working on, as part of the Fit for Work service, a website or a portal, or whatever you want to call it. It'll be an online support for employers and employees. So it'll be a practical toolkit, is what we're calling it, to help people remain at work. We're also exploring the idea of having employer accreditation. So an employer can put themselves through a program and be accredited a Fit for Work company. The last point there is, some of you may have heard of Great Places to Work. This is it's an award that many companies can get, based against various criteria that classifies you as a great place to work. And we're trying to influence their agenda to make Fit for Work part of the agenda, which clarifies or classifies it as a best place to work. So that's it. Thank you.